Behavioral disturbances and emotional outbursts in class can be difficult to manage and distracting for the general classroom. Students with emotional or behavioral disorders, or EBD, are usually unresponsive to general classroom interventions. Since they are proven insufficient, we will introduce you to some effective interventions. Throughout the years, many operational definitions have been applied to EBD. However, no one definition was officially adopted. In 1990, EBD was defined as having multiple and prolonged displays of behavioral emotional responses deviating from social norms that negatively impacts academic performance. Studies have shown biological risk factors and psychosocial environmental risk factors contributing to EBD. Genetic or biological problems contributing to EBD include disorders such as autism, schizophrenia, Tourette's syndrome, OCD, and many others. Some environmental or psychosocial factors include unstable households, inattentive caretakers, lack of nurturing relationships, poverty, and child abuse or neglect. Maltreatment is one of the most influential and significant contributors to the development of EBD in children. Consequently, it is important that teachers immediately report any suspicions. Some warning signs children with emotional or behavioral disorders may display are disproportionately high rates of inappropriate behavior, low rates of positive appropriate behavior, academic difficulty, and difficulty connecting socially with peers and adults. Since inappropriate behavior is considered by many parents to be a stage early in life, most students with EBD are not diagnosed in their first few years of schooling. This has a negative effect on the student because early intervention that may have worked did not take place. Students with emotional and behavioral disorders are identified as such because behavioral management systems, even those researched and foolproof, prove not to be enough to meet their needs. High-tiered and well-planned supports will be needed. In the classroom, the most evident characteristics are inattention, noncompliance, and disruption. Teachers should set attainable goals for students with EBD to comply with teacher requests, attend to the right things, and stay engaged. Keeping students with EBD engaged lowers the opportunity for behaviors to arise. A common misconception is to expect students with EBD to constantly exhibit emotional or behavioral disturbances, when, in truth, EBD is actually episodic. Like frequency, intensity varies as well. Problematic behavior is usually prevalent in novel environments such as a classroom transitions. According to researchers, students with EBD tend to be blamed for their problematic behavior. It can be difficult for teachers and peers to remember sometimes that this student has a disability and that affects their behavior. The given strategies will show alternatives to punishment or containment. A strategy that a teacher may use in the classroom is to alter the antecedent, or alter the delivery of your request. Many teachers say what they struggle with the most is noncompliance from students with emotional or behavioral disorders. When a student with EBD is noncompliant, use precision requests. In order to effectively use precise requests, teachers should deliver requests in a predictable manner. They should incorporate consequences such as reinforcements and punishments and provide wait time for compliance. Remember to be specific and be sure to deliver on your consequences. Another intervention strategy is called behavior-specific praise. Since students with EBD tend to be punished more often than the average mainstream education student, research recommends using positive reinforcement instead. Students respond better when their efforts are being recognized. To use behavior-specific praise effectively and efficiently, compliments need to be issued in a timely and appropriate manner, accompanied by specific informational statements that cannot be misconstrued. An example would be, "Annie, good job on filling in all the blanks of your worksheet," immediately after Annie finishes her assigned task. Also, teachers can use self-monitoring as an academic intervention. This allows the student to self-monitor their behavior for a set period of time. Authors suggest starting with independent activity time. This has shown positive results in academic productivity and on-task behavior. Since keeping students with EBD's attention on a particular task can be challenging, self-monitoring can help. The student feels more involved with their work because they have to grade themselves. They are more likely, according to research, to stay on task and think positively about the activity. Giving students with EBD choices in how they approach schoolwork is another effective intervention. Children are more likely to comply to requests when given choices, even when closed-ended or limited. It gives students a sense of empowerment and usually results in a decrease in problematic behavior. In order to implement this correctly, teachers must first identify the problem area. The teacher can then establish choices that can be made in each context and have students choose from a list. Teachers should monitor the student to determine how the choice affects behavior. Finally, transfer choices to different aspects of the classroom. As of late, 3 initiatives have helped assessment of students with EBD. They are person-centered planning, strength-based assessment, and functional behavioral assessments. Person-centered planning helps write the student's IEP by keeping long-term goals in mind. It helps consider long-term solutions and interventions that will be personal for that student. Strength-based assessments focus on students' strengths and promoting accomplishments rather than weaknesses. Functional behavioral assessments take into account multiple reasons for behavior and help implement positive behavior supports. These all help the teacher not feel that they are in this alone.